Okay, good evening, everyone. It is a real pleasure and honor for me to have dear guests, Professor Halawa and Dr. Teodora with us this night. And also I'd like to welcome all attendees because we have professors and colleagues from Egypt, from Arab world, and from UK also. And before we are going to start the number of attendees, the maximum now. So we are starting now with 100. And then after this interactive session, the video will be uploaded in the morning tomorrow. To start with, this is a very unique Zoom meeting because we are speaking about a very hot issue from the professional way, from the ethical point of view, plagiarism. Because the English is not our native language. So this is why we make copy and paste all the times. And this is a bad habit that will be modified by these Zooms and by training. So plagiarism and research dishonesty, both of them are very exciting topics. We have Professor Ahmed Halawa. He's the Consultant General and the Transplant Surgeon, Sheffield Kidney Institute, Sheffield Teaching Hospital, Sheffield, United Kingdom. He is Associate Professor, University of Liverpool. He is the Program Director of Postgraduate Education in Transplantation, University of Liverpool, United Kingdom. We have the Dr. Teodora. It is a pleasure and a privilege to have Dr. Teodora because she is ethics expert for the European Commission. She is a lecturer in Clinical Ethics, School of Medicine, University of Liverpool. In just 2 minutes, I'm going just to highlight the speakers and the moderator. So Professor Halawa, as I mentioned, he is the consultant and transplant surgeon at Sheffield Institute, associate professor in Liverpool, program director of transplantation. I'm honored to share with Professor Halawa in the diploma and the master of transplantation in Liverpool by giving some presentations. This is a qualification of Professor Halawa from the starting career from 1983. So he's a senior surgeon, and this is the degrees that he achieved all through his career from qualification. The main interest in the scientific kidney transplantation, transplant immunology, surgery of the parathyroid, and postgraduate education. So this is a vast, and he is talented in all these aspects, surgery and education as well. And the most fantastic is he is also musician because he is a professional doing well on flute and the buchlo player. And I heard from him a lot of musics. These are the awards and distinction, a lot of awards every year. And the achievement, 76 international presentations, 127 publications, including 2 book chapters on the editorial board and the reviewer in many scientific and international journals. And he has composed and transposed more than 100 music sheets, fantastic, Egyptian and Western musics to be played by flute. And this is another miracle. I enjoyed always to hear and to see Professor Halawa doing this hobby of flutes. One of the merits of Professor Halawa, he transmitted his experience in doing surgery for parathyroidectomy in all Egypt, in the Kahliya, Mansoura with Dr. Osama Shahat team, in Tanta, Sohag, Upper Egypt, the armed forces, hospitals, everywhere. Professor Halawa taught many surgeons in Egypt, and this is the advantage. Nowadays, we have a team who is mastering the technique of parathyroidectomy because of Professor Halawa. Last year, he visited Urology and Nephrology Center, and he did 4 cases, very difficult cases of parathyroidectomy. And this is was very appreciated by Professor Halawa in December. He was also acknowledged everywhere from Tanta, and he shared us in the many Zooms in transplantation, and this is one of these interactions. In the Virtual Academy of Egyptian Society of Nephrology, he had a lot of lectures and videos that enriched our virtual academy and education in nephrology, dialysis, and transplantation. This is the second time to have Dr. Teodora with us. She shared us in the ethics presentation lecture for, and this was a collaboration with Mansoura Faculty of Medicine Internal Medicine Department, and we enjoyed so much her expertise in the ethics, and her comments enriched this session that was around 2 hours. And this meeting is unique, and I'm going to leave Professor Tamer, the Vice Dean of Mansoura Faculty of Medicine, just to welcome the guests and just to give a welcome message and to introduce to this seminar and Zoom meeting. Professor Tamer.
Okay, thank you, Professor Hussein. Actually, I'm very impressed by the CV of Professor Ahmed Halawa, and I don't know that he is a musician also. This is a very good talent, actually. I like music also. So yeah, so I'm welcome Professor Ahmed Halawa and Dr. Teodora. I'm looking to hear from you about the plagiarism and the research dishonesty. I am the Professor of SAD and the Vice Dean for the Postgraduate Studies and Research, and I would like to extend that meeting, and we can arrange more collaboration with the Faculty of Medicine. I know this is your home, so I am looking to collaborate more, and we are looking for more cooperation with our faculty. So I'm looking, I will not add more that Professor Hussein said, so I will leave the stage for you to present your presentation. Thank you very much.
Thank you very much, Professor Tamer. Professor Tamer is a Vice Dean, and he has also established a very nice PhD degree in phonetics. And this is, I think it is an international degree. Am I right, Dr. Tamer?
Yeah, phoniatrics, a phoniatrician.
Yes, yes, yes. Yeah. Excuse me. So I would like to.
In UK, it is a speech language pathology, but in Egypt and like in Scandinavian countries, we are in medical speech language pathology. So we established that in Egypt here in Mansoura University. Thank you.
Before the start, I would like to welcome all professors and guests with us in this Zoom. I see Professor Ahmed Halawa and others. So welcome all. And I think Professor Halawa now, would you please share your slides, and then you can introduce Dr. Teodora and start your presentation.
Yeah, it's already on the screen. So how to share it?
Share it, minimize the PowerPoint, and then from the share screen, click on it.
On share screen, click on it.
It's something in the bottom. Yeah.
Dr. Mohammed Al-Hadidi can help.
Yeah.
Yes, Mohammed Al-Hadidi is with us, and he is. Yes.
Dr.
Yes.
Ahmed.
It is now okay, Dr. Ahmed.
Yeah.
Okay.
Yes.
Yes.
Open the show, please. Slideshow.
Yeah, well, give me a second.
So, and excuse me, Dr. Ahmed and Dr. Al-Hadidi will help us as the co-host management. So now Dr. Al-Hadidi is the co-host for this meeting.
Thank you very much, my friends, my colleagues, and even my family as well, because a few family members joined my son-in-law, and my daughter, because they are planning to do a higher degree in medicine and pharmacy. So plagiarism and academic dishonesty, you'd be surprised. There's a lot of people actually, not necessarily in the East, plagiarize, but in the West as well. And I will present few cases actually to make the session more interesting, and stories as well to show the magnitude of plagiarism and the penalty. Not only the plagiarism, because the plagiarism is part of research dishonesty, but again, we'll address research dishonesty and how to avoid it. So an overview. So I'm going to focus on the unethical aspect of academic writing and research. The two webinars are not planned to address how to write a paper, because this is a big topic. But I'm teaching you not to damage your academic career and blow up your future by committing this sins. So part one, which is today, we'll discuss plagiarism, we'll discuss research misconduct, which is research dishonesty, and requirement, briefly, a requirement for awarding a degree. Plagiarism means stealing. Who's a perfect writer? No one is a perfect writer. Perfect writer does not exist, but someone is better than the other. So there's always room for improvement, but no one is perfect. And this is to reassure myself and reassure the audience as well. So what is plagiarism, how to avoid it, and what's the penalty involved? Plagiarism is stealing somebody's work. Just be aware of the word stealing. It's really stealing. Without permission, without giving him or her the credit of the work he has done, and claiming the work to yourself or the writing to yourself. But as a matter of fact, it's not your work and you shouldn't have the credit for it. But you denied somebody's credit. You have stolen somebody's right. Why it happens? Lack of knowledge and skills. You may not be aware of the procedure of citation and paraphrasing, but this is your fault. You should learn about it. Lack of confidence. I can't write it, I can't do it. What you will do next is stealing somebody's work. But you will discover that writing in medical English is not that difficult. Cultural differences. Is more common in the non-Western societies, non-Western communities. For one main reason, they were taught plagiarism and the principles of academic honesty early on during their career. Cognitive issues. You are not aware, you don't perceive that what you have done is wrong. Lazy and lack of time management. You left the assignment or the dissertation to the last minute. You need to submit it next day morning. Tomorrow is a deadline. What you will do is spend all night stealing somebody's work and present it as your work. Language barrier. Poor command of language. However, when you write a paper or dissertation, you need to write in a simple English. It's not a Shakespearean one. It's not a novel. Medical English is simple. So let us go through the types of plagiarism. And I'm presenting real life examples. Type 1, which is copying and pasting. Exactly, copy and paste, word for word. Of course, without paraphrasing, without referencing. If you look on the right-hand side here, this is a software called Turnitin, which is a plagiarism checker software. it will check how much was stolen and put in your thesis, on your article. Here, this fellow stolen 80%. So 80% of his work was a stolen work. And the software, which is being used now by many universities, many journals, will highlight the plagiarized, the stolen part in different color. You can see all this red stolen. And actually, they are very smart, these softwares. They will tell you, what did you steal from? So 71% came from this article. Actually, when you click on it, it will show you the article. 5% from this article, for the next one. 3% from this, 4% from that. So copying and pasting. Another type, which is common, called patch plagiarism, patchwork. If you look at the trouser, I put it on the right-hand side, exactly like this. So you steal phrases and clauses, sentences from somebody's work and stick it into your thesis, your article. Again, without paraphrasing, without referencing, without acknowledgement of the original author. I will give you example of patchwork plagiarism. This is one of my publications, the 3rd and 4th renal transplant, technically challenging, but still a valid option. This was published in Annals of Transplantation, 2012. If you put this sentence and forgotten to put quotation marks or without referencing, it will appear as patchwork plagiarism. So it has to be like this, between quotation mark and the reference. What's missing here, the page number as well. Paraphrasing plagiarism. So stolen ideas, intellectual plagiarism. So stealing somebody's idea without, again, acknowledging the original author. You might be good in paraphrasing, so you put it in different context, but still the idea belongs to somebody else. An example, the 3rd and 4th renal transplant, technically challenging, but still a valid option, by Ahmed Halawa, published in Annals of Transplantation 2012. I can put it differently. I can steal the idea like this. Retransplantation, because 3rd, 4th transplantation is retransplantation, is difficult operation and always technically demanding, but still a reasonable alternative. So I have stolen the idea, but I ignored the original author. I didn't acknowledge the original author. The software wouldn't pick it up, but the examiner who reads your thesis, reads your article, the reviewer, will pick it up. So this highlights the importance of referencing, because you shouldn't steal somebody's work because you don't like somebody to steal your own work as well. It's unfair. Unintentional plagiarism. Where the quotation is wrong or missed, or the citation is incorrect. Again, is it a plagiarism? Yes, it is plagiarism because it won't be shown as a citation for me. I won't be credited. The system will not show my name as my, citation of my article. An example, again, the third and fourth transplantation. I think I'm killing this article today. Instead of Ahmed Halawa, I put Muhammad Halawa, completely different person. Even the journal, I deleted the analyst of transplantation, put transplantation is a different journal as well. So it won't be shown as a citation for me. Still considered a plagiarism, still a sin, still a crime. What about self-plagiarism? Can we self-plagiarize? Yes, we can. When you present your work again as a new work, you publish the work already, and then you write a new paper, and you take part of your published work and put it in the new paper as a new work. You didn't reference it to the old paper. Again, it is a sin, it's a crime, it's a mistake. It's a stolen work because you claim it twice. Avoiding plagiarism, how to avoid it? The word honesty. Again, don't lie, don't cheat, don't steal, because you don't like this to happen to you. Simply speaking, use your own words. You don't need to be Shakespeare to write a simple but good medical English, but there are rules and regulations of medical writing. You should learn about it. And I will give you a course. Actually, I'm very grateful to Dr. Hadidi, who gave me this website, which is fantastic. And I will give you the link. It's a free course. I will give you the link at the end of the second webinar. Acknowledgement of the original author. Cite it properly. Use quotation mark when appropriate. These are the building blocks of how to avoid plagiarism. Why we need to avoid it? Come on, doctor, it's easy to copy and paste. No one will see it. No one will discover it. It's an old paper published in 2001. The examiner won't find it. They will. Software will find it. If it's an article and you did plagiarize, if it is a minor plagiarism, like category A, and I will come to the categories later on, the article will bounce back to you and be asked to amend it. Waste of time, waste of effort. You could have done it right first time. If it was bad plagiarism, B and onwards, category B and onwards, the article will get rejected. And up to a quarter of the articles being rejected by one publisher because of plagiarism. So the effort you put in research, the effort you put in writing, and then just ignoring the writing honesty, this will blow up your effort when the article gets rejected. Yourself, you'll be declared dishonest. It's quite an embarrassing situation that to reject the article because of stolen work, your thesis get rejected, of course you will fail. Assignment, fail. If repeated, you'll be dismissed from the university. Time management. Do it right first time, saves time, saves effort, saves money. Training is a good opportunity for you to learn the academic writing, which is not that difficult. Fine. Let me give you a hint about the similarity report, which is like Turnitin software, and apply University of Liverpool principles of academic dishonesty. It will give you different colors. It depends on the degree of plagiarism, the extent of the plagiarism, how much you have stolen So the red one is the maximum one. It's acceptable when the similarity, which is the extent of plagiarism, less than 25%. But not only that, it shouldn't be more than 8% from a single author. Even the similarity was 20%, total similarity 20%, and you have 9% from single author, this is a plagiarism. Or if you lifted your stolen paragraphs like this, it's called plagiarism as well. These days, they are very strict about plagiarism. And I will explain to you later on why. Each university has academic integrity policy. The staff and the student should know about it. I don't like you to get confused between the type, which is the, I discussed before, and the category. Category means extent, which identifies the penalty. Category A, minor error, missing quotation mark, minor mistakes in referencing. In University of Liverpool, you will lose 10% of the marks straight away. You will get warned. The editor of the journal will send the paper back to you for amendment. Category B, which is basically a poor academic practice, poor paraphrasing, inadequate referencing, your mark will be capped to the 50% straight away. You get warning. Here, actually, the article will get rejected straight away. Category C, which is massive, extensive plagiarism, like the 80% I showed to you. You get nothing, you fail. Article will get rejected. Not only that, it could be a legal prosecution. You could be fined because intellectual right, copyright, breaching of the copyrights of somebody else. Category D, again, if you repeat it, category C twice, if you're a university student, you'll be kicked out. Finish. You work in a coffee shop. You are no more university student. Career is over. Penalty for category A is very bad. When you commissioned or purchased coursework, it's called contract cheating. You pay somebody to do your homework, to do your thesis, to do your assignment, or you fabricated or falsified data. You made it up. Penalty, even from the first offense, you don't need to repeat it. It's just one offense is enough. You are done. You are gone. No mercy. And this is the summary of the procedure we follow in University of Liverpool. It's not different from other universities. All are the same. And this is a link of the course, the free course, which I'm going to pass it to you through Professor Hussein Sheashaa after the second webinar, called Writing in Science. Also, there is a free book here on writing well. However, it's an old version, but works very well. It gives you an idea about academic writing in English. So in summary, the penalty ranges from 10% to termination. Why to do this? We need to do it right first time. Life is stressful. Do I need to add more stress by plagiarizing? Of course not. So let us move to research misconduct. Of course, anybody does a degree, it must be involved in research. There are 3 types of research misconduct. But believe me, all of them treated the same. It is just academic classification. Fabrication, you presented a data never existed, never done, an experiment never happened. You made it up. Falsification, you tweaked, you twisted, you manipulated the research material, the data, even using the wrong statistics to achieve usually positive results. Look to the sentence, this sentence, and this actually will give you what's meant by falsification. All my cats are white. However, there's only one black cat. I ignored the black cat in counting intentionally. It is called falsification. So I'm not presenting the reality. Plagiarism is one of the research misconduct. You find plagiarism is everywhere. Also, is a common malpractice in the research. I called it the 3G. Ghost authorship, guest authorship, gift authorship. Ghost authorship who did the work, but his name was removed, deleted. He could be paid by a pharmaceutical company for some reason or another, or his work, somebody stole his work. Professor Hussein mentioned actually non-English speaker, native speaker, but the BMJ, British Medical Journal, reported 1 in 10 publications committed ghost authorship in 6 medical journals in 2008. Even in UK, we do it. Guest authorship is like putting a well-known and famous name on the article to give it a credit. However, this name or this author didn't do any work. It's called guest authorship. Guest authorship, which a co-author who hasn't contributed at all to the work, and his name was put on an article as a gift. So you scratch my back, I will scratch yours. You put my name on your paper, I'll put your name on mine. This is called gift authorship. Research misconduct damages, causes damages to reputation, of course. You may lose your career, or even you can be a killer, may kill your patients. 3rd-degree murder, unintentional killing. Because you falsified, you fabricated data, resulted in wrong treatment. And this is why it is very, very unethical. How common research misconduct? Again, British Medical Journal shows 1 in 7 in UK-based scientists declared that they have seen some of their colleagues fabricating or falsifying data for the sake of publication. Trust me, it's not worth it. One of the journals actually is a publisher, Taylor and Francis, as a famous publisher. You know, up to 23% of all submitted contents been rejected because of plagiarism. So it's quite common. People try to take shortcuts all the time. What speed camera? You'll be interested to speed. Lockdown because of coronavirus, you'll be interested to go out. It's not like human nature to break the rules, but we should have higher control, ethics. To control our bad behavior. Individual cost. Yes, I will remind you of this story called Gutenberg story, Gutenberg case. Gutenberg, Karl Theodor Gutenberg, who was a former German defense minister. He was a very famous guy, very famous politician, and expected to be the next German chancellor. What happened? Somebody digged in his past history. They found that his thesis, PhD thesis, was plagiarized. What happened? His career finished as a politician. Not only that, he's still facing legal prosecution because of copyright infringement. So it costs a lot. Can lead to jail. Yes, this is a real case. All these cases already on the public domain, so I'm not breaching confidentiality. Eric Folman was interested in research on aging, hormone replacement therapy, plead guilty of falsifying 17 grant applications and falsifying data in 10 research papers. He was the first scientist to be jailed for fraud in 2006. Not only that, he was fined $200,000. Brand damage. Of course, the one who's doing research on the big research institute, university. This university or research institute, they spend fortune to build their names. They need this brand to attract more students, to get more funds from the government. You blow up this by committing this crime. They did a favor to you, and you return the favor by damaging their brand, their reputation. It's unfair, unethical. I will give you a nice story. Again, all names are already on the public domain. Dr. Potty, he was researching on cancer in Duke University in 2010. He had many publications in journals with high impact factor, Lancet Oncology, Blood, PLOS ONE. In 2010, he was accused of falsifying his research data. and committing fraud. What happens? This crime was covered in the media, 60 minutes in one of the news channel, American news channel. This was in Duke University. Of course, we know that Duke is one of the famous universities. You know, Duke classifications in colorectal cancer and grading. You know, Duke is a good brand. It took a while for the university to recover from this scandal. Capital cost. It costs the society millions of pounds. Investigating consequences of wrong treatment, trials. We could direct this money to proper research, to give it to honest people, to conduct research, to impact on science. Human cost. You falsified or fabricated data and presented. Some of your colleagues will take the conclusion you came to and apply it to patients. So the wrong treatment, because all these data are falsified. There is a known case as well, Scott Robin. He's an anesthetist, and his main interest, he was interested in post-operative pain. He fabricated at least 21 papers and published 10 of them in a journal called Anesthesia and Analgesia. It's a famous anesthesia journal with high impact factor. They discovered the falsifications and fabrication. Papers were retracted, but the damage is already done because his suggested treatment was implemented. The wrong suggested treatment. Patients were treated giving the wrong advice. And look to the editor-in-chief, what he said. We are talking about millions of patients worldwide where post-operative pain management has been affected by research findings of Dr. Robin. So we put patients in misery because of this guy, because of research misconduct. Preventing research misconduct, again, is honesty again. And also our duties to teach our students and our colleagues doing research the principles of data collection, research methods, citation, plagiarism. On the first day, when I meet my postgraduate student for a higher degree, explain to him results are not important, whether positive or negative, but we need to get it right, write it properly, methodology is right, justification is right, explanation is right, figures are not falsified, and we have to explain what we get, whether positive or negative results. Penalty, and this is why all these stories are already on the public domain, to learn from them. Of course, plagiarism software is a common practice now in many of the universities. I will give you my slides, free to use after the second webinar. But there is a link here where you can find all funny, nice stories. However, not nice, it's misery, it's miserable stories. There are miserable stories for people who committed research misconduct and outcome of the research misconduct. One of the reasons of researchers falsifying or fabricating their data is the fear of negative results. As a matter of fact, all of us are not open-minded. To be honest, I like to hear that, you know, my student get positive results. Ah, yeah, well done, good. And I will tell you why, but this is not an excuse. We get disappointed if we get negative results. Even may not be interested as well if the results came back negative. We are all biased to our positive results. Yes, because publishers as well, when you publish your work, because one of the aims of doing research is to publish your work. Publishers are not interested in negative results. But if you look at it, in many occasions, negative results are very valuable. In cancer research, drug X does not cause cancer. Good, so it's not carcinogenic, so safe, it can be used. Or drug X does not cure cancer. Oh, I shouldn't use it. I shouldn't subject the patient to the side effect of the drug, the cost of the drug. I can direct the treatment into a different pathway. Saves money. So negative results, publishing negative results are important. In reality, positive result does not give you the whole picture. One side of the coin, one side of the fence. If somebody did the same work and showed that results were negative, so mean the work is not, the positive result not reproducible, this is a serious event. This will invite us to reevaluate the whole process, to analyze it in depth, why the positive is positive, why the negative is negative. So you need the black color to feel the white one. You need the light to appreciate the darkness. If negative results are not reported, you will still carry on doing the same thing, which is done by somebody else, was not published, but it's still negative. So waste of effort, waste of money. Lastly, I will touch on the requirement of awarding a degree. You need to have a theory. A theory which is a significant contribution to the science. Either you analyze a new knowledge, develop a new theory, or even revise an older one. So the work is done before, but you would like to see whether it is reproducible or not. So the idea should be good. Relevance. This is my personal opinion, actually. It should be relevant to science, relevant to the community. Science is life. Science is living, not on paper. Let me say I'm in UK. It would be ridiculous to investigate and research of a rare disease in Zimbabwe It's pointless. It wouldn't help UK people. You're in Egypt. You need to do some work which reflects on your science, reflects on your community, helps patients. So the relevance is important. Knowledge. You should be aware of the methodology you have used. You should be aware of the scientific background of the topic you studied. You should be aware of pitfalls of the techniques you have used. Quality. It should be of high quality, worth publication, publishable. I didn't say published, because it may not get published. Why? Negative results. Quantity. If you study PhD for 3 years, the amount of work you do should be covering the 3 years. Master degree in 2 years, 2 years. Did they mention positive results? No. But you need to justify the results you got based on scientific evidence, scientific facts. And most importantly, don't lie, don't cheat, don't steal. It will cost you a lot. Thank you very much. These are the references. And part 2, hopefully next week, because part 2 actually will discuss real life scenarios, cases I have seen and I dealt with. Thank you.
Thank you very much, Professor Halawa, for this very nice presentation. It's really interesting and exciting for all of us. I just have 2 points, few points to allow Dr. Teodora to have her share and then to start the discussion with Professor Tamers and others. So regarding the point you mentioned by the authors who are afraid of negative results, we should put in mind that the a good research equal a good question. And we shouldn't expect an answer and to prove this answer from our expectation. And this is a bit of research. We have research to answer a question. I learned a lot from my professor, Muhammad Sobh, here at Mansoura, and Professor Sobh is awarded the state award, the highest award in the country, because of his excellence in research and others in academic career. One of the most important sector of Dr. Sobh evolution in research is his work in schistosomiasis. He did a lot of publications from theoretical pathogenesis and the management of schistosomiasis. And almost of his research in schistosomiasis, the answer was negative. But it was very nice answer for the question, both it is practical questions or academic questions, and the research was negative. Although it is negative, it was published in highly ranked journals, and this is why he is awarded all the awards in the country here in Egypt. The second point is the regarding relevance of the research. I think the best research in the intervention studies is double-blind, placebo-randomized controlled study. By double-blinding technique, this means to avoid both selection and the performance bias. Even if the answer is, at the end of the day, will be no benefit. It is negative, but it is in double-blind fashion. It will be published in one of the first-rank journals. So we shouldn't be over enthusiastic to publish positive results, although I know that for some journal there is publication bias. I'd like to stop here to allow for the discussion, and I'd like to start with the comments of Dr. Teodora. We are eager to hear from Dr. Teodora. Yes, the mic is with you, Dr. Teodora.
Hello.
Hello.
Thank you very much. It was such a complex and detailed presentation that for me, you know, it's not much to add to say. So I mean, what Professor Halawa did, he presented actually, if you like, a survival guide in the academic community. I will call it, because I will talk about other things, but before that, I would say those are the rule of the game. So if you want to be in academia, if you want to have a name, you have to respect those rules. Now, why people do those things, why those things happen, and to the extent, you know, it's quite shocking to see the extent of, you know, plagiarized articles submitted to prestigious journals. I remember last year in April, I was at the European Commission conference in Romania, and someone presented there, I think was the representative of bioethics from Croatia, presented a fantastic, I was actually searching for his presentation, a fantastic amount of data about amount of falsified research. You know, so it is incredible in science, where you will not believe that people might play with those things. So as Professor Halawa mentioned, you play with people's life, you know. It's not you falsify poetry, you know, you falsify data, you create medicine, drugs that can kill people, you do so much damage through that, you know.
You kill, yes, you kill people.
Yeah, you kill, yeah. And this is, you know, this is the most disturbing fact, and it is the scale of it, you know, that it's so much. And ages ago in 2005, 2006, I did some research regarding stem cells, and there was another big case, Hwang Woo-suk in Korea, who I'm talking now from my memory, from what I remember. So he said that he discovered an extraordinary things regarding stem cells, and they can cure paralyzed people. And I think was even a series of stamps with someone, you know, walking from paralyzed in a wheelchair, and then so walking. And it was a very, very big scandal when they discovered that the research was falsified. Initially, it was published in Nature and Science, and, you know, very prestigious journals, and then it was falsified. And it was, you know, a very big East-Western problem there. And of course, there are lots of tensions. And I will talk about that, and I will talk about language. But before that, I want to say, regarding the second part about research misconduct, I was working with my colleagues from the European Commission of developing something that was called ethics by design. So so far is just an idea, but the idea is that, you know, when you do a grant application, when you do a research proposal, you should have ethics implemented from the beginning. So ethics should be implemented into the methodology, and not some tick box that you do by the end, or you copy from someone else's grant and you just put there, or tick some boxes and yeah. No, so you need to think about that. You need to think about the ethical problems, because they will come. They will come in your research. They will come later. And so this is why you need to think, when you do the methodology, in the same time to do the ethics. And this is how they become one part, you know. And then you will have a way, yeah, it can be positive, it can be negative. As you, Professor Halawa, said, negative is sometimes more important, you know, than the positive when you have to test a theory. Now, if I might go to the first part regarding plagiarism, and I very much like when you mentioned this fear of the language, and I for the first time, maybe, I was quite happy that, you know, English is not my first language, and it's not even my second language, and I don't know if it's my language at all, you know. So
Good English.
thank you. I'm a poet in my free time, so I can play with the words a bit. What I want to say, I learned French in school and I was very good in French. My first philosophical article on Leibniz, I wrote it in French. Then I wanted to learn German. I learned German. I managed to publish philosophy in German, which was for me, the task, because it's the language of philosophy, was considered to be the language of philosophy. And then my personal life brought me to the UK, and then I had to learn English. And it is very hard, and it's very frustrated, because especially, and I think it's the same from people from other culture, you are established in your culture, you have a certain amplitude, complexity, beauty of thoughts, and then you have to express yourself into a language that is not yours. And it's very frustrated, because you feel like a child. You feel the people look down to you like you're stupid and you cannot say what you think. And this is very, very, very frustrating. And now, when someone told me here, when I come to the UK, it takes between 7 and 10 years to achieve the standard of academic English. I mean, I don't know, for medicine, maybe it's a bit easier, but, for writing, for example, in philosophy, I must say the time is quite right. So it's very, very challenging. And I don't want to say that is an easy task. Now regarding medical English, I must tell you, I worked for 10 years as a medical interpreter. So I was translating English, Romanian English, sometimes when I had German patients as well. And it is easier. But of course, you have to deal with patients, different degrees of understanding. And the most complicated things are the metaphors. When you have to translate metaphors, they're already dead metaphors, from a language into another language. And I give you an example. I had to translate clubfoot, which is talapes, yeah. And it is, it was impossible. Or other thing like the cardiac shunt, when you have a little hole between the chambers, a shunt. How do you translate that? I had to translate the letter. How do you translate that in a language, in other culture, in other language? Because they are not things you can represent or people working in everyday life. So they are very complicated. And I end up reading, Romanian journal articles to find that. But of course, nowadays, and this is another problem, all the high impact journals are in English. So basically, we impose English on people from other culture in order to have their research published. And it is, people talk about linguistic imperialism and so on. Otherwise, English is the lingua franca, and without us, we could not be here tonight and understand each other, So it's very complicated, but I want to say that I have all the compassion for people who struggle with language. This is one aspect. And honesty, as Professor Halawa said, honesty is a different thing, and stealing stuff from people, it's a different thing. But as I said, the struggle with language is something that should not be overseen, or it is a very, very hard topic. Then of course I think it's very important, the educational aspect for the students. We have to teach our students. We have to teach our students to play. And it is because most of the cases, and that's not for students coming from other cultures, that's for English students, they commit plagiarism because they are lazy. And they leave things to the last moment. They don't want to do it. And it's easier to copy paste. It's easier to pay someone to do that, or, to ask a favor for a friend than to do the work yourself. Then it is another thing in other cultures, and I must say I was subjected myself to that after I finished the university. Someone who wanted to be professor asked me to write a chapter for him, and offered to pay me to write this chapter for him, yeah, because he needed a book in order to be professor. And I said no. And I said, there will be no difference between, someone who does other things for money and me doing these things. And this is something that will stick to you throughout your whole career if you commit something like this. But what I want to say, people do pressure other things. And we were, just after the university, without job and without salary, and those people can be abused. And of course, that's what it's very important to to set things right, to have a culture, to have codes of conduct and academic rules for these things. So this, I think, those are very very important ideas, and I think in the end, it is about honesty and about how we want to be perceived. Thank you.
Thank you very much. Thank you very much, Dr. Teodora, for your very nice and valuable comments. If you remember, when we spoke about ethics, the difference between ethics and law. Ethics is superior to law because ethics, the person is guilty because he think to violate, just thinking without even violating. So we need ethics. We need to raise these issues from the early beginning of medical school, even from childhood. Fortunate enough, we study medicine in Egypt by English, and in the most of Arab world, it is in English. And in the new generations of medical students are fluent in English. So I think the English language is not a big barrier for medical students and doctors. And the major problem is to enhance education of these issues from the early beginning. Now, Professor Tamer, I'd like to hear from you. Please unmute yourself.
Okay, thank you, Professor Ahmed Halawa, for this interesting lecture. Actually, I enjoyed it very much. And as you said that the negative result is the same as the positive result, I mean that the negative result is the positive result in itself. I have a question for you, Professor Ahmed. You mentioned in your presentation there is the cut, the primary source shouldn't exceed the 8%, and the primary and the whole thing shouldn't exceed 25%. Is there any cut-off percentage for a journal? I mean that is that different from journal to other, or is it international percentage?
No, it's different from journal to other. But remember, it depends on the amount of work. If you submit an article, 2,000 words, of course, the cutoff will be very low. If you submit a thesis with 12,000 words, the cutoff will be a bit higher. So, but for articles, nearly, all of them are the same. And they look at as well, because, software, the plagiarism software is a software, does not think.
Yes.
Has no brain. So basically, he matches word for word. And this is another job for us who don't to be technology minded and just rely on the figures and numbers provided, given to us by this software. We need to read through why this, similarity is high. You discover that the software picked up the references. The software picked up something, patient's name. It's already in the public domain. So again, the number, back to your question, the number does not mean a lot unless you read it yourself. So, and this is why the cutoff is vague cutoff, subjective to the reviewer review.
Okay, great. Professor Hussein, I think there is a lot of questions in the chat, and they are very interesting. Yeah, please.
I like Professor Halawa to go to the chat to answer the question one by one, so we can read them together and then try to answer them.
The first one, the PowerPoint in the first slide.
Yeah, this is not a problem because it seemed it is. Yes.
Send me the post link. Yes, I will.
but Professor Halawa promised us to distribute the lecture at the end of the second webinar, because I think the second meeting will be more exciting because it is applied with scenarios, 13 scenarios, touching everything about plagiarism. The second point to Dr. Halawa.
Yeah, this is by JJ, one of my students from India. Then 25% limit is even for an article publication. No, because article publication is different, because an article usually 2,000 words, 3,000 words. I think I explained this to Professor Tamer shortly. So the cutoff could be lower than that. Again, we don't rely on figures and numbers. We have to review these figures and numbers ourselves to make sure that the software does not pick something wrong, because it will pick. If you put Ahmed Halawa on an article, the software will pick it because Ahmed Halawa already on the internet. So it doesn't think that Ahmed Halawa is a name, it's a word.
I think if we go back to laziness, because sometimes we imagine if we put comma or space, it will be okay to avoid plagiarism. And I think the software is smart, taking all these points. Please comment on this point, Dr. Halawa.
Actually, you know, we have to adjust the software itself to miss quotation marks, because the software does not think it will match it word for word. So there is in the adjustment, in the setting up, so exclude quotation mark. Take on it, so it will exclude quotation mark. There's a question here: does the Grammarly plagiarism checker work well in detecting plagiarism? No. The straightforward answer, no. Why? Grammarly, you know, if Turnitin has more than 10 million articles and websites and links. Grammarly has much less than that. So it depends on the database. Why you rely on this? Just do it yourself. You know, write it in your own words. Easier, quicker, cheaper, saves time.
Yes.
Any other question here?
All the rest
can you
is
update us? When is the next lecture? Next lecture is next Wednesday, same time.
same time. Yes, I'm going to announce with the link before the meeting by 48 hours. If we go back to the negative results, I think the most important articles published during the last decade in New England Journal of Medicine and the most publication intervention studies in nephrology as a specialty are negative results. So we should be honest in our work irrespective to the results, because the results are the answer for the question. We have here in this Zoom figures and legends from Egypt and from Arab world, and it's your time. If you have any comments, you can raise your hand, and then we are going to unmute everyone. To start with Professor Magdi Sharqawi. Unmute yourself, Dr. Magdi. Yes,
thank you.
Yes.
Thank you very much, Professor Hussein, and thank you very much, Professor Ahmed. Elegant presentation and enlightening about plagiarism. And I think what we should tell our students is to rely on their thoughts, not to rely on other thoughts, because it's very, very important. We have to teach them how to think, and they shouldn't be ashamed of what they are thinking. We have to encourage them to publish, especially first in local journals, then in international journals. Very important start to publish is by starting by case studies. This is very, very easy to do. It will be in your own words. It will encourage you to put your own word. And the worst thing they do is review articles, because this is where plagiarism is there. And I review a lot of publications, even from Western international journals. Many of them are just repetition, summarizing, and there is no philosophy in reviewing this review article. And I think the main issue that we have to teach our students is how to think critically in what they are writing. And I agree with what Dr. Teodora said. It's starting from young generation and encouraging them to be honest. This is very important. And finally, I'd like to ask Professor Ahmed, is there a punishment for those who commit plagiarism? Will journals stop them from publication anymore? You know, in our Arabic culture, when we have a narrator, even in Hadith, who is lying once, he will never be accepted again as a reference. Is this in the international journals? Do they agree on this?
No, but still they can submit again, and there is no clear penalty. But what happens, as I mentioned, there's some fabricated and some plagiarized work being subjected to fine, So legal action being taken against. And this is even worse than rejecting an article. So imagine yourself, fabricating or falsifying data and then end up in court or in jail. Of course, this actually happens, at a larger scale when, you are committing crime day and night for 21 publications as the case I presented. But there is no strict rules and regulations for somebody who committed plagiarism, again, or did it again. So, and this is actually because they are interested to persecute you. They are not interested to go down to the legal channel because they're very busy. Okay, reject this article, move next to the next. They're not bothered.
If you allow me, I have here a comment about this point, Dr. Magdi, because we have an experience with some international journals. If we do double publication, if we publish a study and then republish it again in another journal, what will happen? This happened with one of my colleagues a few times, that the publisher doesn't accept publication from this group, not only one author, from for a period of time. And according to the publication, the signal is 1 year or 2 years or forever. So there is some punishment about this point.
This is fair.
Yes, and another point, because you mentioned it is better to start the training with publishing in the local journals and then international journal, but to avoid double publication, because this was an old trait that we do publication with a local journal, it is not known worldwide, and to publish after improvement in another journal. What happened nowadays is the majority of journals are tracked by Googles or others, and this is a very risky. For example, African Journal of Nephrology, it was not, it is not PubMed indexed, but nowadays it is Google searchable. So if you write any article in the African journal since a long time, and you now wanted to repeat it, you'll find this is double publication. So we should be careful about this point.
There's a question here. If we write the original author and take a copy and paste from the article, this is not plagiarism. This is definitely plagiarism, 100% plagiarism, because you have to paraphrase it. Paraphrasing means write it in your own words. Reflect it, think about it, write it, put it down in your own words, and cite it properly. Put the name of the original author next to it. So this is definitely, plagiarism.
But it's the real problem, Dr. Halawa, because sometimes I publish a randomized control trial for 1 year follow-up of certain intervention. Then after 5 years or 10 years, I want to republish, but not the 1 year results, but I'm going to publish long-term follow-up. So the demographics is the same. So a big sector is the same. How to manage this problem, Dr. Halawa? If you would like to publish long-term follow-up of one of your old studies.
Actually, if you write it properly and you write actually the original article next to it and you refer to it, because, tables, you can't change, numbers, you cannot change, figures, you cannot change, but the words you can change.
Yes.
Sometimes, my last book chapter, which about infection, donor-transmitted infection. So I referred to the Italian guidelines of transplantation. And there's a big table. What I did, basically, I paraphrased the whole table and I write clearly Italian guidelines and the the article and the website and everything. So it would be better to paraphrase it, to reward it in your own words. This is,
excuse me, it is easy for the review or for chapter as a review, but if I want to say 5-year long-term follow-up of drug X, then the table 1 is demographic criteria. So how to refer to the original one? Is it allowed to say the demographic criteria in the first article published by?
Yeah, why not? Just to refer to it. You don't need to put it down. But there will be some plagiarism. This is why it's not 0%.
Yes.
We mentioned 25% here. You know what I mean? So it would never be 0, because again, even if you authentically zero, meaning you have reworded every single word, the software will pick up something. And actually, in the scenario, I will demonstrate some examples where the software, by mistake, because the software does not think, picked up few things, which is irrelevant. But we have to review it and to make sure that these figures and numbers given by the software is right, is genuine.
Okay.
Sometimes, Professor Ahmed, there is a redundant publication. Sometimes we work with other category of physician, like we work with pharmacists, we work with science, people in scientific, they republish the same study, but their point of view, this pharmacist point of view, and I think this is accepted, but they have to refer to the study in the publication. Because I witnessed 2 studies of them, both published in the internal medicine journal and then in pharmacist journal.
But the percentage shouldn't be 70%. You know, the similarity index or similarity percent shouldn't be 70%. You know, if you're talking about 4, 5, 6, 7%, it's acceptable.
No, it's more than 25%.
25 is too much. You know, 25 is too much.
Okay. We felt the importance of plagiarism when we want to introduce our work for award, and plagiarism is really an important factor that is a real barrier for award if there is high percentage of plagiarism. Now, Dr. Faisal, Professor Faisal Shaheen from Saudi Arabia.
Thank you very much.
Thank you very much.
Professor Halawa, I enjoyed too much your talk, and I was waiting for it, and unfortunately I didn't attend from the start because it is full. So your house was full from the start. Okay. I am very happy to see your talk. Actually, it is one of the very important issue which we are facing. I work as executive the editors for more than 20 years of our Saudi journal for kidney disease and transplantation, and we were facing this really a problem. But I will tell you frankly that we usually didn't take actions as severe as you think. We just send and reject the case, except in 2 cases we found it is the pilgrim is very high. Even I gave it to my daughter at that time, and I told her, please, just I don't like to send a rejection for this colleague, which I know a long time. Just see it. And she came to me and said, Dad, look, it is 94% is taken from copy and paste, and she bring all the references with her. So we were actually didn't take the action, but just we reject. And in one case, we told the author that this is being taken from, and we brought the reference, and he never answered us. So it is a problem really, and we should be careful in choosing the authors and the article and from where it's come, and it is really very important. I enjoy your talk very much, and this trend was taken by, I have to admit that Prof Abu Aisha, if I think everyone know him from Sudan, and he was in Saudi. He started to speak about this subject many times in the Congress, and also it's been handled very well from Mansoura group, Dr. Ahmed Halawa and his colleague, Dr. Sheashaa as well. All of them were talking about this because it's an ethical issue and very important, and reflect also the institute if they are doing good in their research or not. I have one question. This was a comment, but one question, if you don't mind. If someone submits his paper to one journal, which is, and usually some of those journals are very late in answering about acceptance or not, and he is in hurry probably to be promoted in the university or something, so he submits the same article to another journal. Well, I don't know what's the situation for him now, and how it will be handled, which can happen many times. Or he took, some the comment of the first journal and try to improve it, and he went to another journal which maybe ranked high a little bit and submit the paper in it. What do you think about this? Thank you.
The more important thing is the publication. Was it published twice? You're
No.
talking about review. So 5. So not published twice. This is the most important thing. You know, sometimes we know this article will get rejected, but still we submit it. Why? Because, you know, we'll see what the other reviewers will say. Will say, and actually we'll take their review, you know, honestly, and try to amend the article and submit it. Oh no, this is good work. You deserve more than this. So we'll submit it to another journal with high impact factor. So it's all about publication rather than submission. Submission is still, you know, there's a problem with submission as well. You know, there's some journals will reply to you in 2 weeks. Some journals you never hear from them except in a year time. So, you know, they have their own bits, which should be done. They have their own work as well, which should be fulfilled, but they don't do that. And even they don't acknowledge, some of them don't acknowledge receiving the article.
I agree.
But my point, if you allow me, Professor Halawa, I don't like this style because we know the well-developed and the prestigious journals will reply in 8 weeks or even earlier than this.
Not all of them.
Yes, but the problem is, and this was a case scenario that we were confronted with, the article was published simultaneously in two journals. Unfortunately, the two journals send the articles for the same reviewer. So it was
embarrassing.
Yeah, it is because the reviewer mentioned, I received this article for to be reviewed by the journal X, and it is now in journal Y. How does it come? And it was very bad for the author and for the center. So I don't like this way. We submit our articles to the journal who reply quickly, and then to have their comments and then improve the writing and to be submitted even for the other journal, even if it is even more superior. But to avoid, my advice is avoiding the simultaneous submission of article to two journals or more. It is not a nice way. Dr. Tamer, do you like to comment about this point? Dr. Tamer? Okay.
Yes.
Do you like to comment on submitting the article to two journals simultaneously?
Actually, it is, we know that when we are submitting an article, we should write
yes,
that we shouldn't submit it to another journal. So it is not an ethical issue, actually. We should wait until the journal should say that's not. Yeah. But the issue that we use the reviewers' comments to submit it to another journal is a very good idea. Actually, yeah, it's okay. That's okay. That's no problem in that. Actually, we sometimes we submit it to the highest one, rank it to know what is the ideas and what is the reviewers' comment, and then I submit to another journal to get to be published. So yeah.
And this is what I learned from Professor Sobh. Professor Sobh said you can send your article to the highest ranked journal, and then you can improve and build your experience from the comments of the reviewers. But I don't like the submission because, as Professor Tamer mentioned, if I write this work is not submitted to another journal or not under submission for revision in another journal, it will be an ethical point, and we would like to hear from Dr. Teodora about this point. If we breach if we write a comment or a sentence and we don't apply it.
Yeah, well, it's quite complicated, and I assume in science is a bit different from philosophy, and it is indeed very annoying. Sometimes you wait for months and you don't have any reaction. Sometimes you write again to the editor and they don't react, and then you don't know, you are blocked with this article, and we all know we have pressures to publish and so on. So it can be a real issue. But I assume if you want to send it to another journal, maybe you should mention, to write to editor and mention it was submitted, but I don't have any feedback from there, and then, to ask them. That will be the honest way to
This is the only solution. The only solution is I write one of the co-authors, send it, and I don't know if this is a way to just to have a solution for this problem. But it is unethical to send an article to two journals simultaneous, and writing it is not under revision by another journal.
Yeah. There's a question here.
Yes.
If I did paraphrasing and acknowledge the author, should I add quotation marks as well? No, because quotation mark, if you copy and paste the something from the author as it is, and then you need to put quotation mark and the reference. But if you paraphrase, no need for quotation mark.
Yes.
But you need to write the reference.
Another question here, could we get the presentation? Yes, and the certificate. If one of my colleagues or attendees would like to have a certificate, I think we can design a certificate signed from Dr. Halawa and from our side here from Mansoura Faculty of Medicine, Dr. Tamer. We have Dr. Tamer with us. Can we do this, Dr. Tamer?
My pleasure. My pleasure.
Yes, yes, I think it's no problem. And this is what we do even in all Egyptian Zooms for the Egyptian Society of Nephrology. Anyone wants a certificate, we write an electronic certificate. No problem.
Yeah.
Just
there's a question here.
Yes.
If we write the original author and take a copy and paste from the article, this is not plagiarism. Again, I think I did answer this question. It's definitely plagiarism because you need to paraphrase. So paraphrasing and citation. Paraphrasing and citation.
Okay. So if any one of my professors and colleagues wants to add any comments, please raise hand and we are going to unmute. Certificate.
There is some asking about the software. You recommend the software for the plagiarism?
No, what I recommended is to write it in your own words. I didn't recommend software.
Yeah. But there is a software to help us at the checker, a guide.
This software, actually, Turnitin is a proper one. It costs thousands of pounds. It's quite expensive one. But, why to pay money, to check plagiarism? Why not to avoid it from the first place? It will be cheaper, easier.
But actually, in our university, in our faculty, we have for every department we have software. We have Turnitin actually, so it's a guide for the authors before they submit their thesis or the articles to check for their plagiarism. And also we have Authenticate, which is another software program in the university. So that's, these two are available in our university.
Yeah, but this is provided by the university. It's likely like, exactly like University of Liverpool, but it's not for individual purchase, There is a question here where we should not forget from low-income countries that sometimes lead author to commit guest authorship to cover the cost of publication. This is not right. Again, it's still a guest author. Basically, Dr. Mahmoud mentioned asking whether if I put a co-author just to pay the cost of publication, is it justifiable? No, it's not. It's still a guest authorship.
Dr. Ashraf?
The Turnitin is the best. Yes, Turnitin is the best, but again, it's a software, does not think, hasn't got a brain, so we need to review all the results of Turnitin as well. Difficult to acknowledge every author in the article. We have to. It is his right.
Dr. Said Al-Ghamdi, Dr. Mohammed Al-Hadidi, please.
I unmuted him. He should unmute himself.
Dr. Said, please unmute yourself if you want to add any comment. Dr. Said Khamis, Professor Said Khamis.
I am muted for Professor Said anytime. I think he should press on
Okay, no problem.
the microphone button on the bottom of the screen.
Do you have any comment, Dr. Al-Hadidi?
No, I think that the presentation was crystal clear. It was perfect. Thank you so much.
I think we are waiting the scenarios, because scenarios will be more interesting and exciting. Dr. Said raised his hand, so unmute Dr. Said Khamis, Dr. Hadidi.
Good evening for all. Professor Halawa, one question, please, if you don't mind. Unfortunately, I was acutely rejected from the meeting, so I couldn't enter again. I don't know how it comes. And you know, immunosuppression was beneficial. Anyway,
No, it's not intentional.
Oh.
For sure, I think Hussein is the one did. Anyway,
You can blame him.
Yes, yes.
Yeah. Just for joking.
Yes.
Regarding the quality of publication in the COVID era, before, if you dream, in my dream, to publish in New England Journal of Medicine, it will be a big dream. Now anyone can publish here and there, and it's so easy. What about the quality of this publication nowadays in the COVID era? I think it is very hazardous. What do you think?
Actually, me and Mohammed, actually, we have written a nice paper on based. Remember the cases we presented, the 8 cases transplant patient who contracted COVID-19 in Sheffield, and basically we missed the boat. Our first submission to New England Journal of Medicine bounced back straight away, in spite of absolute rubbish publication being published. And some of them, you know, 2 cases, 3 cases, badly written, horribly written, horrible. And actually, they were not peer reviewed. But it looks like the journal recovered, you know, after that. And actually, they mentioned clearly this paper is not peer reviewed. So it looks like it was a diarrhea of publication.
It
was again. The journal is back to life and very selective.
Yes. But the problem is, Dr. Halawa, and this is again regarding the comment of Professor Said Khamis, the scandal of Lancet and the New England Journal of Medicine for retracting articles. And you mentioned in your presentation articles retraction. Because if the article is breaching the methodology or honesty, this is another punishment, is to be retracted. And when the article is retracted, it is bad for the authors and bad for the journal too. I would like Professor Halawa to comment about this, the issue of article retraction.
It's quite embarrassing.
Yes.
I think about that. I mean, you raise the expectation and hoping that you publish a nice paper in a journal with high impact factor. At the end of the day, they accuse you of stealing somebody's work, plagiarizing, and throw the paper back to you. So it's quite embarrassing, of course. You know, no one will like that.
Okay, you have a question on the chat. Please go.
It's a long question,
yes.
Professor Nagwa.
Yes.
I need to take a day to read it.
Yeah.
In case of some authors submit an article to one journal, not responded by rejection or acceptance for a long time, then the author must send, just a second. The author must send an email message to the journal to response if accept the article, and will publish if rejected and not published because of author want.
I think it is now easy for us as authors submitting an article to withdraw the article. Withdrawal of the article means that I send a message to the journal. I'm sorry because you are late and you have no time to wait. So I withdraw my article, and it is an ethical way to go another. Yes, please.
Can I comment on
Dr.
that?
Tamer, please. Yes.
Sometimes journals they found one of the reviewers accepting the articles and the other rejecting it, and they are seeking for another reviewers to take a decision. And sometimes this take a time. If the journal is under review, So we should respect that because sometimes the editor find it difficult to get to the for that. So this is, but if it is not under review, it is just with the editor or just in the office, I think, yeah, you can withdraw the article. And
so at the end of the day, I have the right to withdraw my article.
Yeah,
yes,
this is, yeah.
This is, regarding retraction, Dr. Halawa, because one of the attendees asked about what's meant by retraction. Retraction means the article was published already, and it was reviewed after publication, and there is a problem in the methodology or honesty or the results. Then a committee investigated the article and examined the article, and at the end of the day, they found the misconduct or bad methodology, and then the journal announced the article is retracted. This means as if not published. And if you go to the journal site, you will find the article and a signal of retraction. And this,
there's an important question here, Professor Hussein. Actually, thank you, sir, for the educative session. Whom should I cite? The most recent reference or those who were cited in the most recent reference, or maybe both? All of them.
But here, if you allow me, Professor Halawa, we should avoid quoted reference, because sometimes if we go in depth to the quoted reference, we can find a very strange point.
Actually, you find this in review articles, yes.
Yes.
And this is one of the problems with review articles. But if I did the work and you did similar work and you got similar results or nearly similar results, both of us should be cited.
The problem is, Professor Halawa, because this is the common scenario here in our habit, that if the original work was published since 20 years and is taking a statement in an article published last year, then I'm going to use the article published last year. It is just quoted reference. Nonsense.
Yes. Yeah.
It's nonsense. We should refer to original one. And quoted references shouldn't exceed 10% or less than 10% for the total references.
You know, colleagues, actually, what we need is what we need to do what we need to do our best actually to get it right. Not necessarily you will be 100% right, because no one is 100% right on earth, but you put an effort to get it right and to be honest as much as you can, and that's it, really.
Okay, I think it is very nice session today, this night, Professor Halawa and Dr. Teodora. Very appreciated, and you are welcomed every time. And I think it's a good channel to collaborate with you and with the University of Liverpool. And I'm leaving the mic to Professor Tamer to close this session.
Thank you, Professor Hussein Sheashaa, for organizing that. Thank you, Professor Ahmed Halawa, for this wonderful session. We are looking for the next Wednesday. And also thank you, Dr. Teodora, for this, your comments. And I'm waiting for the next Wednesday together to hear the live scenario. Thank you very much.
Thank you very much, all my professors and colleagues. And I'm going to publish the link for the next meeting soon. Thank you and goodbye. Thank you very much. Goodbye.